So many scientific bodies, including WHO, have stated that homeopathy medicines should not be given to the serious illness patients. So how do you overcome that, or how do you address it?
Homeopathic medications are allied system of medicine. It is always an alternative system of medicine, and we do have certain limitation. I'm not saying ki road traffic accidents or any emergency case you get into my clinic, I'm going to take. No.
So during Corona and after Corona, there was netizens who were saying that poison in a jar of water, doesn't work. So this is not a preventive measure and things like that.
We have lot of records kept during the corona breakdown time. While taking homeopathic medications as a preventive medicines, those patients were asymptomatic. They never showed the symptoms at all.
Welcome everyone to High on Why podcast. I am Sukita Srinivasan, your host for the day. In today's episode, we have truly multifaceted guest, Dr. Shilpa. Dr. Shilpa is a renowned homeopathic physician, a founder, and a practicing psychologist, a medical cosmetologist. Dr. Shilpa's unique blend of expertise offers a holistic approach to well-being, encompassing physical, mental, and aesthetic health. We are eager to delve into her insights and learn more about her integrative approach to medicine. Can you tell us more about your practicing?
Yeah. First of all, hi Sukita. Thank you for inviting me as a guest.
Thank you so
And I'm Dr. Shilpa Vikas. I'm a homeopathic physician and cosmetologist. My way of looking at health or the well-being of a person is internally, like how much healthy you are, like with your organs and the cells and all these things put together. Externally it reflects, like your beauty reflects externally when you are healthy inside out. That is the approach, and the treatment is what Provital Health actually concentrates when the patients are there. So I'm being a homeopathic physician for almost 15 years. I came across patients having this PCOD, thyroid, female issues basically. So having hormonal imbalance. So they have come up with this acne and hyperpigmentation on the skin and the hair fall, like female type baldness and all. So we used to treat homeopathic basically treatments, but somewhere there was a limitation for us. So then I started doing a lot of research on this, like what can be added with this treatment, like because homeopathy treatment is no side effect, basically there is no side effect, and we have a permanent cure for the diseases. So then I wanted to give a different approach altogether. And then I did my fellowship in medical cosmetology. So then we started with integrating homeopathy and cosmetology together with the similar philosophy, keeping in mind no side effect, non-invasive, and the permanent cure. So here we blend both together.
Okay. Interesting. Is really interesting. And as you said, you have a 15 years of experience in this field, right? And you have 7 branches in Karnataka till now. So can you tell me more about your entrepreneurial journey?
So it's a long journey, is what I can say. It's basically for me what was main motto was to give service for the patient, and I myself have that. Interest in keeping myself like elegant, always presentable, and like when it comes to health, keeping up with the diet, and like maintaining yourself, all these things. Being a doctor, we have that little conscious, right, to keep ourselves healthy. So that is what I wanted to serve even my patients actually. So, I had a pretty good experience with my homeopathic knowledge, being trained under a renowned homeopathic physician. His name is Dr. Nadoja B.T. Rudresh, and he's a president of Ayush department. So I was an assistant doctor for him for almost 6 years. So I have like a very good knowledge in homeopathy, where I get any type of cases I can treat. It might be incurable autoimmune disorders, complex cases, chronic illnesses. We have multiple, like we have seen many cases there with him while practicing. So basically, I have a pretty good knowledge in homeopathy. So while treating, like I learned all this pretty well, like how to keep yourself healthy with nutritional balance and all these things. Then later, when I had my own practice as a single consultant at a small clinic, then I realized like I need to do something more for the society. Then I joined this chain of homeopathy clinic. It's a renowned chain of homeopathy clinics. And they have like around 50 branches across South India. So I was a senior homeo consultant there, and I almost worked for 4 to 5 years there. So as a senior homeopathic consultant itself. So I was like even treating a lot of patients there with good testimonials. After coming to me, they had a pretty good experience with homeopathy treatments and as well. So I learned basically how the chain of homeopathy clinic runs, like whether it might be related to the marketing and serving the patients and giving service to the patient, like how they maintain it, having in spite of having so many branches. This was like fascination for me actually, like it is beautifully like organized. And then I had a talk shows like on TV interviews. So it's like I have given till date 450 plus TV interviews, like on renowned channels like TV9, Praja TV, and Kasturi, and then it was Udya News. Now it is not there. So all these channels, we had a talk shows like how homeopathic treatments is better. And we used to educate people through media. So that is also one of the marketing aspect what I learned there. And giving articles in the papers, like newspapers and all. So there it was a journey for me, where my entrepreneurship maybe got ignited there. So after my that corporate experience as a doctor, I did my fellowship in medical cosmetology. Like, keeping this integrated system, like I did a lot of research on this, like how to overcome this challenge. Like patients want more, like than homeopathic medications. They know it is no side effect, permanent cure, and herbal based medicines, all these things, but they wanted more from homeopathy. So I cracked it and made it like a homeopathy with cosmetology.
How did you get interest in cosmetology? I mean, is that because of your mentors or how it is?
See, basically, cosmetology is like challenges what I was facing with the female patients. Like, lot of women's used to come up with like how to keep up our skin glowing. Is homeopathy having something like internally to take, or acne problem, pigmentation problem, hair fall issues, and when you're having this hormonal imbalance, right? There is a even whole body there is a uneven skin tone, means exposed area to the sun, there you will have a lot of pigmentation. So they used to come up with lot of queries for me. So there was little limitation. I'm not saying ki homeopathy don't have treatment for that. No, definitely we have treatment for that, but there is a long course for that. Duration is more. But they used to ask me instant relief, or the effectiveness should be there within 2 to 3 months. So this made me think, like being a woman, like how to overcome this. Even if I am there in their place, what and all the symptoms they come across. So then I started with this course, and then I have learned each and everything in cosmetology, but I only integrate which don't have side effects. So cosmetology have certain procedures which don't have side effects. So that we are integrating with homeopathy.
Okay, so now patients, like even men or women who come to your clinics, so what is the major issue they come up with?
So lots of patients, even middle age and old age people, they come for anti-aging treatment. So I have treated a lot of celebrity clients as well. So I get a lot of tele artists and cine artists. They come mainly, we don't have side effects and non-invasive treatment. So this is what clicks for them. So I've treated a lot of like maybe 55 to 60 plus celebrities till now with the similar concept.
So here I would like to ask, so for example, people coming with, problems, or people coming for, such kind of treatments, like I want to beautify, or, something like this anti-aging treatments and also, what's the ratio of such kind of patients?
See, basically, if you're asking like men women ratio,
No, I mean, generally the ratio of people who want to get treated because of some problems and people who want to just, for the anti-aging treatments, beautify themselves, like how we discussed.
it's usually 60 to 70% of the cases comes with some disease related skin and hair issues, because basically skin and hair is on their genetics. Okay, even with their complexion or the volume or the length or the texture of the hair, it is basically genetic. But they want to make it more voluminous hair, or they want to get a fairer complexion and all these things, that is genetic related. But 60 to 70% of cases what we get in the clinic is like related to the diseases, say like nutritional deficiencies or hormonal imbalance, or like diseases like metabolism related. So these kind of diseases we see like related to the skin and hair issues.
Why I came for this is people are more conscious on their looks these days, right? So treatments like, we were also discussing earlier about the IV thing and the Botox and fillers and things like that. So how is that at your clinic, and what is the duration of such treatments you undergo?
See, basically, what happens when the client or the patient comes to us, we take in detail case history for them, and we do have to run few blood tests for them. Like we have to diagnose whether it is disease related or nutritional based or genetic related. Depending on that, we are going to definitely put internal homeopathic medications. But when it is like they want to beautify themselves, like say for example they want to have their complexion increase, or the hair volume to increase, or the hair fall reduction and all these things, we have certain steps we have to follow that. And depending on that, we explain in detail patients, you have these options. Like for few, if I have to come up with an example, nowadays like brides and grooms, like they have this pre-photo shoots, pre-wedding photo shoots, and during wedding they want to look very what clear skin with the complexion and all these things. We tend to get a lot of patients like that. So for them we will actually give the list of the treatments depending on their blood test and their health issues and everything. So what we do here is we are going to like give the option of IV infusion if there is a nutritional deficiency. Say for example calcium deficiencies, vitamin B12 or vitamin D3 deficiency, so we have to rectify those things. So we are going to advise for the IV. Or else if they have this interest in making their complexion fairer, then we have a IV glutathione. So it is an antioxidant, so it is very safe to take. So we have yearly 5 IVs suggested for the brides or the groom. And then we are going to give this laser treatments, and for the hydrofacials we have, where it is very safe, it's a skin treatment.
One more question I wanted to ask regarding this is, instead of being so many medical practices we can do, but why did you choose homeopathy on first place?
It's a interesting and good question. See, I am, when it comes to Dr. Shilpa, she's very kind of introvert, and I was always like homesick kind. And I do had got this dental in outside Bangalore, like when there was a counseling and everything. So I was since kid, I wanted to become a doctor. Like whenever somebody is asking me like what you have to become, it's like I'll become a doctor. And somehow I manifested that. And it is like I had option of Ayurveda and homeopathy. So then I started doing research what is homeopathy and Ayurveda. So then it was like for me, I was being Bangalorean, I took first language Kannada. So in Ayurveda, you have to do like this Sanskrit. Everything is in Sanskrit. Okay. So even subject wise, you have to even write, give your papers with Sanskrit, it seems. So it was very like anxious for me. Like how I will, if like I don't know the subject at all, but Ayurveda was not a problem for me, only the language was a problem. So it was the option left was homeopathy. So that is how I chose homeopathy.
So, how do you balance multiple ventures? Like, for example, your home and your profession, right? So, either side, you have to be, very effective because you also said that you have children. So, how do you manage all together?
See, basically, I am like a family person. If you ask me, I don't have a lot of friends. I because being in medical field, right? We had all this like 5.5 years plus in like internships and all these things. We didn't had a lot of time to go out or do this thing. I was always studying kind. So after that, immediately I got a placement with Dr. B.T. Rudresh. So it was like I never took a break in my career, I can say proudly.
Oh, lovely. That will inspire a lot of women. Yeah.
Even with kids actually. So it was like after the marriage, back to back I had two kids. So it never stopped me. I somehow managed to do my consultations in the evenings, because it was like an on call consultations and appointments, and with my timing I have never took break in my career. And balancing my family and giving that time for kids. Being a doctor, I know like how kids want their mother to be around. So I was like happy to bring them up. So with that, the practice was only the hard time where I felt was the corporate chain of clinic where I worked. It was literally like Saturday, Sundays on time we need to be there. 10 to 8 job, and lot of patients used to ask me like my consultations, so I was like available there always kind. That was little hectic for me, but still I could come over those time period.
So, what was your major challenges being an entrepreneur you have faced and probably you have overcome? So, with an example, if you can, brief us with.
Yes, when coming to entrepreneurship, like the idea behind this Provital Health altogether was basically like being one of the successful like entrepreneur. With that, giving service, and like personally, I feel it's an achievement. Like for me, like the Shilpa, what I was, and today what I am. I feel somewhere I've achieved a good
We can definitely
milestone.
assess ourselves from what we were and what we are, right? Yeah.
So idea behind this Provital Health was like just one single clinic with this cosmetology and homeopathy, what we had integrated system. That was the idea stage, what we call. Like I came up and I saw like we can give lot of effectiveness through treatments and all. And then it was like for me there was a even a struggling stage, like it will be there maybe once you achieve that milestone, right? Like you are a successful entrepreneur, till then you will be struggling like one or the other way. Like the main challenge what we face in business is financial struggle. having 43 employees and maintaining 7 branches and having few team under management, because lot of decisions should be made from founder's point of view. So that was the challenge where I used to face, and I have done a mistake where I used to do everything, like because I have that idea, I have that vision, and I never used to give that opportunity for the team members or the fellow members. I want to do each and everything because I want that to be as a perfectionist kind of mindset. So I had done those mistakes by not giving work for the concerned persons on it. Like now I have overcome that, is what I can say. Because one person can't run.
Yeah, definitely that's impossible. You have to delegate the work. Yes. So, how was it for you, starting the branches in different places? Like outside the Bangalore, you have a few branches, right? So, how did you deal with, probably the employees or any hurdles over there? How could you overcome that?
See, we had maybe it's God's blessings or something, after Provital Health second year, we got an opportunity of acquiring the 7 branches. It was all revenue generating, all infrastructure setup, and they had other branches in Andhra as well, but they were not able to maintain Karnataka branches. That is where they had to give up the
You stepped in over
branches.
there
Yeah.
and took it over.
So
Okay.
we got an opportunity of acquiring those 7 branches. So, in Bangalore, we have Indranagar, Malleshwaram, and Jainagar branches. And outside Bangalore, we have Mysore, Hubli, Davangere, and Belgaum. So, these acquired clinic, now we have a vision of getting this homeopathic and cosmetology both integrated, all across all 7 branches. So now in Indranagar and Jainagar we have such facilities, yet to come up from Malleshwaram and other out tier 2 cities. We have to come up with the cosmetology concept as well.
Oh, otherwise, it is just homeopathy.
Yes. So till today, it's been 1 year now after the acquisition, we are treating homeopathy cases, and cosmetology we are introducing slowly, so that all 7 branches of Provital Health will be having cosmetology treatment as well.
So, what's your vision over 5 years to bring up your pro-vital health?
We have a vision of reaching people actually, in all metropolitan cities. We are planning to come up with Provital Health, so that will be a future plan with Provital Health. And this unique concept, I want to make it more accessible to all the people, because it is very unique when you ask me, in India or in Karnataka as well. Very few clinics have this, maybe finger counts if you ask me.
Yes, even we have also seen only homeopathy clinics. I mean, not integrated with cosmetology. So this was something very new, for us to also understand and learn, things like this. So many scientific bodies, including WHO, have stated that, homeopathy medicines should not be given to the serious illness patients. So how do you, overcome that, or how do you address it?
See, homeopathic medications are a light system of medicine. It is always an alternative system of medicine, and we do have certain limitation. I'm not saying ki road traffic accidents or any emergency case you get into my clinic I'm going to treat. No, we have limitations because we are not doing any surgeries. We are not doing any procedures any operations or anything. So we do have certain limitations when it comes to homeopathic treatment. So when the serious illnesses are there, say for example any surgical cases kidney stones, gallbladder stones, fibroid uterus, PCOD, or any surgical cases like cardiac related, 80% blockages in the arteries and all these things, so they might come up with the heart attack cardiac blockages. So there, yeah, definitely they have to go for the surgery because it's an emergency case. But post surgery, we do have homeopathic medications where we give preventive medicines not to block further. Or we do have cases where even 20%, 30% blockages, by giving homeopathy medicines, we have dissolved. And even with the surgical cases, we say initial phase of any surgical case, kidney stones, gallbladder stones, varicose veins, any, like even fibroid uterus, any surgical phase, if it is in initial phase, definitely homeopathy can help. But in a critical case or in the last stage of any diseases, definitely they have to go through certain procedures where, or the surgeries, and then if they're coming to homeopathy, we can give the preventive medicines for that.
But in this case, some critics also argue saying, if homeopathy, you undergo homeopathy medications, then you probably prevent the patient to, go and get treated from the conventional medical practices. So how is that, you take it up?
See, with my practice, no, it is other way around actually, because I have 15 years of experience. I get patients like going to 10 to 12 hospitals with such uh, like investigation reports in their bags, like maybe 15 to 20 files, where they have not got any relief from any like symptoms, and they land up in homeopathy clinic. We have like autoimmune disorders, we have some surgical cases. See, when we say conventional medicine, they give a treatment for like kidney stones or gallbladder stone, they remove the stones, but they're not going to assure you it is never going to come back. Right, the reoccurrence is there, right? But this reoccurrence will cause bad effect on human beings. Means how many times kidney stone can form recurrently. So we do have treatment for preventing kidney stones. We do have treatment to dissolve gallbladder stones, and we do have treatments for fibroids to dissolve in the uterus.
So you say it won't even reoccur after homeopathy medicines?
We have preventive medicines for that. I can give you one example where I have seen this case with my SIRS in my SIRS clinic. A patient having CA prostate. He is almost 68 years old, and doctor said after the surgery, they said you have only 6 months with you. Okay, and that patient with some information like homeopathy can treat preventive cancer metastasis, actually we call it as metastasis prevention. So that patient heard and came to homeopathy clinic. Then what happened, he started giving medicines, like he got surgery and everything, chemotherapy, radiotherapy, everything done, but they gave 6 months of time period for his life. And then you'll not believe that patient took homeopathy medicines for 10 years. That is how homeopathy will help you. Homeopathy philosophy itself is, I'm not going to treat you with medicine, I'm going to give you medicines to ignite that immune system or repairing cell in your body to repair on its own.
Okay. So as you mentioned, even cancer patients come to you. So do they come after, the chemos or things like that? Or how does that work at your place?
It usually depends on the cancer where it is placed. Okay. So you have various types of cancer. So very few cases which are safe cancers, what we call is like breast cancers or cervical cancer or the uterine cancer, because when you remove the uterine organ itself, like the metastasis, we can stop. Or the breast, like mastectomy, if we do, we can actually prevent the breast cancer, like getting the metastasis done. So it depends on the type of cancer. Okay, so even the survival chances are very high with your types of cancers, where it is placed and everything. So when people or the patient come to us, is like they come up with one is with the surgery procedure done, chemotherapy, radiotherapy done, but they have the side effects of chemotherapy and radiotherapy. They have a lot of hair fall, they have that weakness, and they weight loss and all these things. So we had patients where during chemotherapy they used to take homeopathy medicine, they used to be fit, because that removes the side effects of chemotherapy or removes the side effect of radiotherapy, where it will help in your metabolism and the absorption happens good with homeopathic medications. So you'll not go into that mode where you're helpless or you're weak, you can't get out of the bed. All these things we can stop with homeopathic medications.
Okay. In fact, this homeopathy medicines, I'm talking about the medicines itself, is like, people say it's a small medicine, you put it in water and drink it, you don't know what it happens. And moreover, there is no descriptive study behind such medicines. This is the saying, which everybody has and people think about it. So, how is that, you break that thing for your patients, and how do they trust you and take your medications?
So you'll not believe, Sukita, like many patient post corona, they ask for homeopathy medicines because whole system of treatment has changed after this post corona. System of medicines or the system of treatment altogether have changed post corona, because they have underwent such type of unpleasant experiences with allied system of medicines, like what they underwent during corona, like going under ventilation and the hospital hygiene and the treatments and the medicines, whatnot, like vaccinations.
Yes.
And
Oh my God, don't talk about it. Even I was one. So bad experience, yes.
they ask knowingly, like consciously they ask for homeopathic medications. Now we may not need to educate any of our patients ki this is homeopathy, how to take, what to do, nothing. A decade back or 2 decades back, we used to explain what is homeopathy, how you have to take, how it is different from other system of medicines. But today people know what is homeopathy, and they themselves voluntarily come to take treatment from us. So that is how altogether it has changed post corona.
So during Corona and after Corona, there was netizens who were saying that maybe a poison in a jar of water, doesn't work. So this is not a preventive measure and things like that. So what is that you have to say on this?
See, during that corona or breakdown or the post corona time, right? A lot of like allied system of medicine claim that they had treatment for corona and they have preventive measures and they had a proper treatment. Means it has to be treated in the hospital kind. We have lot of records kept during the corona breakdown time, when while taking homeopathic medications, preventive, as a preventive medicines, those patients were asymptomatic, they never showed the symptoms at all, and that was also cured within 1 week to 10 days kinds, after taking preventive as a homeopathic medications. So like we do have a proven treatments where we have prevented many of cases, maybe during this chikungunya breakdown and swine flu breakdown, and even during corona breakdown we had preventive measures. And homeopathy did help to many of the population, like nationwide, preventing this corona breakdown, definitely.
And many of them tell about this placebo effect, and homeopathy medicines have steroids. So what do you have to say about it? How can you make your patients trust that no, it's not a steroid, or what it is basically?
I It's a good question, and I get or tend to get these questions a lot from my patients as well. See, we need not to make them believe. It is all there in the books and the philosophies. Okay, it's not like providing the trust for the patient. It is giving the treatment for the patients, where patients themselves will experience the changes within themselves. That is how homeopathy works. And when it comes to the placebo effect, see, I can give you one small example. There is a, Tulsi, right? Tulsi is a medicinal plant, and it has a medicinal property which is good for your cold, cough, and it basically, if you're taking it daily, it increases the immune system kind. So that is in Ayurveda, homeopathy, it still holds good because it is a herbal treatment. So, what Ayurvedic system or that root, what we had like in ancient herbal treatment, no, they used to eat this tulsi leaves or make it churna or make it in a syrup form and all these things as a whole. So that is like how they used to take. But in homeopathy, what we do, whole tulsi is not required for the treatment. It is the component in the tulsi as a alkaloid form is a medicine which we extract from tulsi and store it in a bottle. Like it is a very minute form of medicines what we extract and keep it. Only that is required for your cold cough to go and to boost your immunity and to give that effectiveness. So what we do is that dilution, what we extract from the only the medicinal part of the tulsi is extracted in homeopathy and kept in, and stored. That we are going to charge with our globules. Globules is the mode of transportation of your medications like into your system. So we're going to charge the dilution in the globules and then we are going to introduce to you. The effectiveness is very fast because we have taken only the medicinal content, not tulsi as a whole and giving it to you. So many of them, if they see placebo effect, why they call is because psychologically you feel you're taking medicine and then you're getting treated. So that is why allied system of practitioners they say homeopathy has a placebo effect. So in homeopathy we treat mind, body and vital force is what we call. So that is where each and every cell has a life. So we are going to give treatment for those repairing cells and to make the cell healthier. That is how homeopathy works.
Okay. So also these allied practitioners, have stated saying there is no return, study behind this homeopathy medicines, right?
See, that is not completely true, Sukita. When you ask me, we have been having our own research done on this, and like other system of medicines, they have a like medicines proven on guinea pigs and other small like animals and all. We homeopathy medicine is proved based on human beings. We have given medicines for the humans and then we have proved the medicines. Whatever medicines we have in homeopathy is proven on humans. So that is where we can give the effectiveness. And that is where we can show there is no side effects. And that is where we can show we have a permanent cure. There is no recurrence of the disease. Okay, so these are already been recorded and it's since many years back. So it is not like not proven at all. It is proven on human beings actually.
Okay. So, since I was young, okay, I've seen homeopathy doctors being in that white and white. And yes, I've seen people serving even for 5 rupees, 10 rupees then. And now people, yeah, do serve for, lakhs to lakhs for, as an homeopathy practitioner. So, how is Pro Vital helping people? So, how affordable is Pro Vital?
If you ask me how Provital is different, we are actually a premium homeopathic treatment brand where as we are integrating homeopathy and cosmetology, we do have that treatments for homeopathy as well, because I have a set of patients for only homeopathy treatment and only cosmetology, and we do have an integrated system as well. So it depends on your disease duration, like how long have you suffered with that disease and what and all treatment you have underwent already and how long the treatment has to go on from now on after visiting homeopathic clinic. So we have two types of like treatments given. One is acute and chronic phase. In acute, we do have like short term treatments, and when you go for the chronic, it is a long term treatment. It is again depending on your diseases, and the treatment is also planned according to that. So we bring a premium brand. We have like medicines. We have a premium medicines given to the patients where the combinations and the assured treatment, it is all researched, and with our experience we have done that combinations of the medicines. So like if a patient is telling like I have not found relief in some other homeopathy clinic, how can I come to you and take? Because we being experienced doctors, and I have almost 13 experienced doctors there as a team working for Provital, they do have all this 10 to 15 years of experience. So they know how to treat and how to give a improvement, even in spite the patient has gone to any other homeopathy doctor, but still if they're coming to Provital, we can show the effectiveness. When it comes to the cost, like that was your main question, we are also equally economical, giving premium treatment. Like you do have other chain of homeopathy clinics which they exorbitantly charges patients for their medications, but we being the service oriented, and even each and every doctor has their own experience, we have a premium treatment giving in a better price.
So today there are so many advanced techniques for skin rejuvenation, especially for anti-aging, right? So how is that done at your clinic, or how do you, how do you process it and how do you give it to your patients?
So with lot of innovation, right, we have certain planned treatments or the procedure with the skin and hair where it is very safe, like hydrofacials, certain chemical peels, and certain treatments with the laser for the acne and the anti-aging, and with lot of changes shown immediate effects after the procedures. So we do have adopted lot of innovation into the homeopathy.
So how many men patients do come to your place for such kind of treatments?
Equal I can say, because celebrities comes to our clinic, and lot of patients comes, like they do go for the hydrofacial hyperpigmentation treatments and the male type baldness, because equally now we can see men also have that interest in beautification. So we do have equal proposition of patients coming for the skin and hair treatment.
So I don't know if you knew this thing, ma'am. Okay, so this is done by AIW. So they have collaborated with A to B, and they came up saying like, they have age reversing food and things like that. So how do you see that? I mean, does age reversing food or age reversing does really happen? It can be possible.
So when we say anti-aging, it is all there with your lifestyle, with your sleep, with your mindset, and with your day-to-day working patterns. Okay, so if you ask me, like MNC companies or the night shifts nowadays had a lot of impact on the population, like younger generation, what I say, they had night shifts altogether. Like your mind is set since birth that night you should sleep, right? And after 20-25 years, you're after getting a job of night duty as a call center guy or some US based process you're working, all of a sudden you're waking whole night and trying to sleep in a day. So your mind will get confused automatically, right? Like I've been trained since birth sleeping in the night. All of a sudden there is a drastic change, like daytime I have to sleep. So can you give that 6 to 8 hours peaceful sleep in a day? No. You will have like 2 hours, 3 hours getting up, doing your work again, but night whole, like you will be awake. That definitely is going to affect your body, right? So it is not only about the sleep I'm speaking, it is about your thought process.
Body clock as well.
It is not only with the food, I'll tell you. It is not only with the food. It has to be changed altogether. Like your physical activity, your sleep should be proper. You should have take like nutritious food and stress free. I'm not saying ki you should be stress free, you're not working, you're not. You should have that balance, work life balance, like work life balance with your personal life. It has to be balanced always. Then you can see that automatical reversal of your age.
So as Dr. Shilpa said, we don't have to spend for idlis like 500 rupees and all that. You just have to follow the tips which is given by her. So in Provital, there is a logo, right? So it's a kind of a tree-like logo and for the doctor. So how is that integrated with the homeopathy? Is that integrated or how it is?
See, in our logo, we wanted to represent the holistic approach, like what homeopathic system of medicines, like at Provital, we are treating. Because we have a logo of doctor's symbol, like treating patient, and then we have a tree of life. Okay. And then we have a like people around that. So under that, like taking care. So it is like holistic approach given to the patient. That is what like Provital Health logo represents. So that is what we are doing at Provital Health as well.
Okay, one more thing. So because we are doing this podcast for Women's Day, so I would like to focus more on such questions. So, what is the piece of advice to the young entrepreneurs you would be giving, aspiring young entrepreneurs you would be giving to?
See, basically, what they need to be mentally prepared. I'm telling, being a women entrepreneur, they need to like compromise on few things. Maybe like you'll not be partying more or meeting friends more on all these bases. Like you need to be dedicatedly working on your vision. Okay. And one is like you have to have that belief system in you. Like whatever the idea you have, that uniqueness you have with your business, you should have that belief, no, this is going to work. So that belief system is what they require. And they face a lot of challenges, like how I went through a lot of challenges. They have to like overcome that, and they should not break in between, where they shouldn't give up. If their idea or the uniqueness is so strong, then definitely they should not give up.
Thank you so much. It was really nice having you here, and we could really know more about you and your entrepreneurial journey. And I'm sure it will inspire more others and also the young entrepreneur, women entrepreneurs.
Sukita, it was nice speaking to you on the podcast. It might be my first podcast, but hopefully I have done a justice for this. And thank you for inviting me for your podcast. And good luck for your other podcast and your channel. Yes.
Thank you so much, ma'am.
So, as a woman, I would like to give a lot of good luck and best wishes for the women out there who are working day and night and even balancing the family and the work life, and great going, and happy Women's Day.
Thank you so much, ma'am.